Hello, good people. My name is Nurse Stisha, and I'm a registered nurse. I do work in a local hospital here in the Central Florida area in the emergency department. So what drew me to the emergency room? It was the need for change and challenge. I worked on the oncology floor for 6 years prior to my transition to the emergency department, and it was my first love. I absolutely loved oncology. It was my first specialty after I graduated from nursing school, so I'm so grateful for the foundation. Although we had many patients who would survive and that they would thrive after getting their chemo, but we did see patients that were very, very sick, and sometimes they would pass away. So it took a very big emotional toll on me, and so that's when I decided that I needed a change. I knew that it was always something different when you go to the emergency room. It'll challenge me clinically, and you're able to make that impact on people in a very short amount of time. That is a little bit different about the emergency department. That might be a little different from other specialties, is that we really rely on each other as a team in order for our ED and our department to thrive and flourish, to get patients in quickly, to get them seen fast, to be treated fast. So we work together very, very close-knit. We work very closely with the doctors and a lot of the providers that work in the emergency department. I know that when I worked on the oncology floor, a lot of the providers I wouldn't see until we did rounds, but in the emergency room, we work so closely with them. We're doing bedside procedures with them. So we work really well as a team. We are the eyes and the ears of the providers that work with us. So they put a lot of trust in us. So that's one big thing that I would say that is different. I'll talk about challenges and rewards. One of the biggest challenges with working in the emergency department is that you just never know what you're gonna get. You never know what is gonna walk in the door. So it's very, very difficult to protect yourself when you don't know what's really gonna come in. The biggest challenge that I would say is that sometimes we're not able to save everyone. So every code, it's like you're holding your breath, hoping that you get that rhythm back. And it's never easy to lose a patient. Because it is an emergency room, we can get all types of patients. We get elderly, we get middle-aged, we get children. And so it's very, very difficult every time that we lose a patient. It really does chip away from you. So I would say that that is my biggest challenge. It's the sense of never getting used to losing someone. And I'm so grateful that I have not lost that, because it's a sense of humanity. This is someone's mother, father, child. So that's very, very difficult when it comes to working in the emergency department. But one of the greatest rewards, I would say, is seeing everybody take the time to comfort one another during very difficult times. So even when there is a code and we lose patients, as an interdisciplinary team, we really take the time to check on one another. We're making sure each other is okay. Even during the pandemic, how much we had to band together as a unit, as nurses, that was one of my biggest rewards, to see how our profession has evolved and grown and matured. So when it came to that moment and we had to invite other people, travelers, new graduates, just to see everyone band together and want to see each other succeed and be safe, that I would say that that's one of my biggest. A typical day in the life of a emergency room nurse. It is chaotic. It is organized chaos. I work the night shift, so our shift starts at 6:30, and we do huddle and we talk about what's on the floor and what's to be expected. And then once you get out on the floor, you get report, and it is a non-stop. So that's one thing that I don't think that people really realize, that it is nonstop. When you see someone sitting down, they're not sitting down, not doing anything. It's charting. They're charting on patients that have already left up to the floor. They're getting documentation together. They're getting ready for procedures. Like, it is nonstop. So my typical day in the life is from the time I come into work until I leave, I am up nonstop. We are often left beyond our shift time. So I don't always get to leave exactly at 7 or 7:15. I have to make sure all of my documentation is up to par. All loose ends are tied, just to make sure that I have everything together before I leave for that shift. And also making sure that things are done so our next shift have an easier transition when they come in. So the typical day in the life is chaotic. It's organized chaos, but it is the chaos that I have. One thing about the emergency department role that might surprise student nurses is that You never stop learning. You're always looking up medications. You're always looking up treatments. You're never gonna know everything. It's almost impossible for you to know everything. So you are going to be wanting to utilize the resources around you. The seasoned nurses that are there, the providers, LexiComp if you guys have that available, or any other educational platform, you're gonna wanna use it. So I know that typically people think after a year, 2 years, I'll have this down pat. No, and you are always learning, you're always evolving, and you're never gonna know it all. So I think that's one thing that even myself, I didn't think that that would be. I thought that after a year I would be good, I would have my footing, because remember, I had already been a nurse for 6 years. So going into a new specialty, I was thinking, okay, as soon as I get my footing, I'm gonna be okay. No, I still have questions to this day. New medications are always coming out, new procedures, patients are on things that that we had never heard of. So there's always a time that I'm looking up something. I think every shift that I work, there's never a time that I'm not looking up something, looking up a medication, looking up some kind of procedure, or maybe a drug that a patient overdosed on. There's always going to be change. So when it comes to change, you have to be willing to continue to learn. One piece of advice that I would give an aspiring nurse is to give yourself the time to learn and grow. Be patient and give yourself some grace. You're not going to know it all. You're going to need to lean on the people that work around you. It's okay to feel like you're not doing a good job, because even in those moments, there is growth there. You're not going to always feel like you have it all together, but just know that you're doing a great job. Even when you're changing specialties, give yourself the time to learn the flow of the unit, to learn the different people that you're working with, especially the different providers, because they work very differently. So you have to be able to adjust and adapt. And don't get your feelings hurt, because sometimes we have to learn to understand that we're seeing people at their worst. So sometimes you'll get very mean patients, you'll get other staff members that are frustrated as well, and providers that are very, very frustrated, and it might not be necessarily at you. So I want you to also not take things personal. Thank you so much for joining me, and stay well.